Yes, so as you all can see, I am not Peter Homberg. Thank you very much. I know many of you have met him before, and he's very sorry that he couldn't come. He was very excited about joining you here today, but I'm very optimistic that we can still spend some 30 interesting minutes together and then the roundtable discussion later on. As you already know who I am, I just add that I've been working with Dentons for the last 5 years and the team of Peter Homberg. So I joined Dentons quickly after the legalization at a little larger scale for medical purposes in Germany, and have been following the developments since then. So this is also the topic of the presentation today, the German way to medical and recreational cannabis, because as you know, that's why you're here also, Germany is very much in the center of attention on both the medical and now also the recreational side, which wasn't quite the case if we talk about some 7-8 years ago. So the question is, how did we get there, and what is the consequence of that? What is to be expected also from the coming years? So as the title indicates, I'm going to spend roughly the first half summarizing the development on the medical regulatory side, and then I will come to the latest development on the recreational side here in Germany. And in particular, I will also talk about the draft law that has now been leaked just a couple of weeks ago, that is probably indicating where we are heading in Germany. But first, let's talk about medical. So I said 7-8 years ago, we had a very small market in Germany, if you can talk about a market at all, because cannabis, even for medical purposes, was basically illegal, except if you had an exemption specifically from the Federal Institute for Drugs and Medical Devices. So that meant that there were very high criteria, and we were talking about a few hundred people in Germany that were allowed to consume cannabis for medical purposes back then. So that changed in 2017. Or well, it changed in 2016, 2017. And for those of you who know, I don't know who is based in Germany, so I can get an idea. Okay, more or less half maybe. So you may remember that these were the good old times of Chancellor Angela Merkel, head of a conservative government together with the Social Democrats, and not quite the person you would have expected to push the availability or the access to cannabis. So how did that happen in 2016, 2017? Is basically the government had no other choice. They were forced to do so because there was one patient who had one of these exemptions. He was terminally ill, and he applied to the Federal Institute for Drugs and Medical Devices, BfArM, for also an authorization to grow cannabis at home, because he said, I'm ill, I also have to pay for the product myself, so it's very expensive and it may prevent me from getting the treatment that I need. And also, if I'm allowed to take it, why can't I grow it for myself at home? And he thought that obviously, well, the other way around, he started doing that and he indicated it to the BfArM, and immediately the BfArM reacted and sent him the cease and desist letter. So this went through all of the institutions, all of the courts, up to the Federal Administrative Court in Leipzig, which you can see here on the second picture, and they gave right to the patient, and they said, yes, indeed, given the circumstances, that it's so difficult to access the product for you, and that you are allowed to take it, then you must receive also the authorization to grow it at home. And this was, of course, as Peter always calls it, a nightmare for the legislator, because you just imagine a few hundred people in Germany being allowed to grow cannabis at home legally and uncontrolled. So that's, sorry, that was too quick. So that's what pushed the government back then to say, okay, we have to find another legislative framework to make sure that patients can actually access cannabis, but without being allowed to grow at home. So that they would change the circumstances in such a way that it's no longer justified, or that it is justified to prohibit the growing at home. And that's what happened, and that's why in 2017, so in 2016 the draft law was proposed, and in March 2017 the Cannabis as a Medicine Act came into effect. And that basically means, as many of you know, that doctors can now prescribe cannabis somehow as an ordinary kind of medical treatment, even though it must be the last option. So they must prove, or they must make sure that everything else has been tried before and it didn't help. But then they can resort to cannabis as a treatment. And that also comes with the effect that public health insurance was then allowed to pay for it. They don't always pay for it, but it's at least possible since then. Together with the Cannabis as a Medicine Act, a study has been started. So over the 5 years after that, doctors were required, in theory at least, to notify all of their cannabis patients to the BfArM, to the Federal Institute for Drugs and Medical Devices, so that they could run a study and evaluate what is the outcome after the first 5 years. In reality, many doctors didn't participate or didn't really send all of their data, and it's, you know, the database for this report, for this 5-year report, is quite low considering the number of patients that there were. But it has still been completed, and there are some interesting findings. Like, for instance, if you look at the indications, then you can see that in Germany, really by far the largest indication that cannabis is used is pain treatment, whereas in other countries you have other indications that are much more relevant and that are almost not considered by German physicians. And then another development very recently in March 2023 on the medical side is that we have this institution that's the Federal Joint Committee, or the Federal Joint Administration, as it says here. They are basically there for negotiating and fixing pricing for the reimbursement by public health insurers. And they have taken up the matter of medical cannabis, and they have changed less than expected, because the fears of the industry were that they would take a much more restrictive approach now. But what they have said, for instance, and that's a new thing that will be shaping the market on the medical side in the next years, is that priority is to be given to finished products, or to products other than cannabis flowers, so also to extracts. That means, due to, well, they considered the risk of abuse, but also the standardization is in particular important, so that you have, it's easier to ensure a standard quality with finished medicinal products. And you know that there are not so many finished pharmaceuticals containing THC on the market, but that is going to be considered by doctors in the future. So doctor can still prescribe flowers, but the risk of the public health insurance not covering those costs is higher, and they are already refusing to pay in quite a significant number of cases. So it changes from one insurer to another and from 1 year to another, but we're talking about something between 60 and 80% of the treatments that get accepted right away by public health insurers, which means that there is still between 20 and 40% of applicants that get their treatment refused by public health insurers. Often because of formal mistakes, because the forms have not been filled out correctly. We're still in Germany, but it is a significant problem. If we have a quick look only at the numbers, then you will see simply that the numbers have increased since 2017. You will also see that in every year since then, the demand, which is on the right side, on the light blue side, has always been very much higher than the actual imports. So now we have also cannabis grown in Germany, of course, which adds up to the imports, but there is still this mismatch, and you can still see that much of the German market is still secured by imports. On this slide, you will see the numbers per quarter, which also shows you that, because in the slide before you didn't have any numbers for 2022. Now you can see that even in 2022, from each quarter, the numbers of imports increased, despite also the cannabis grown in Germany adding up to that. With this being said, yes, Germany still relies in majority on imports. That's the one point. We are talking about individual patients. We don't have complete numbers of that, and we don't have complete statistics on that, but we're talking about something to our understanding between 80,000 and 100,000 patients. And of course, you know, the initial gold digger atmosphere from the first years, where some thought that we would reach 1% of the German population as a cannabis patient, as was the case almost in Canada. That didn't happen. We are very far from that. But Germany is still, and will probably remain, the largest medical cannabis market in Europe, as you can see in the numbers here below, which is really a big gap already between second place Italy. So when we talk about the numbers in what does it in value, that means that in 2021, the last numbers that we have on this, we were talking about 185 million euros covered by the statutory health insurance, because you see references to statutory health insurance a lot. I don't know if you're not from Germany, you may not be aware of the proportions. So we have approximately 90% of Germans covered by statutory health insurance. So that's the vast majority, and the other ones are either privately insured, or they have a hybrid system because they are public servants or the self-payers. But 90% of Germans are in public health insurance, and public health insurance is the one that is providing the numbers that we are using to analyze. But as I said before, many of the cannabis patients get their treatment refused, and they then become self-payers. So these numbers are not in here. The actual numbers are probably significantly higher than what we have here. But yeah, that's what we know so far. Okay, that was a quick overview of where we came to on the medical side. Now we are talking about the hot topic at the moment, and the hot topic probably for the last, I would say, few months, half a year, maybe more, because it's very much in the center of political attention, as you know. So we have some developments that have been like a roller coaster, because in 2021, a new government was formed, the so-called traffic light coalition, due to the colors of the three parties involved. And for the first time, a German government declared in their coalition agreement that they were going to legalize cannabis for recreational purposes. So that's a very big step. The Greens have been arguing for that many years, the Liberals also for the last years, and they have taken the lead in this on this topic, and it's there. And what did the coalition agreement say? What did the government fix as a goal for their 4 years of governance? That's basically a full legalization, which people could, one, grow at home, but could also buy cannabis flowers or other cannabis products, wasn't completely specified, in certified shops or also in pharmacies, but like a full legal supply chain from the seeds to the consumer. That was the goal. In June 2022, the so-called consultation process, Cannabis aber sicher, in German is kind of a pun, can translate as cannabis but safe. You can also translate cannabis for sure, was started. And of course, you know, the topic was very much in the center of attention of the public, but it's also very politically very how would I say, very problematic, very sensitive. So thank you very much. Very sensitive issue, because in the process, probably, I'm going to come to that, not only the three coalition parties are going to be needed to actually implement it, but also the Bundesrat, which is the second chamber of the parliament. So it was very important to frame this from the beginning as a project of public health. And that's why Mr. Lauterbach, our Minister of Health, is in the lead of this. The aim of the project was not to make the life of cannabis consumers easier, but the main goal was really to increase public health. So that's why this consultation process took place, where also experts from other countries, like from Malta, for instance, from the Netherlands, contributed their opinions, and well, the German lawmakers could take that into account and make their decision on whether to follow that example or not. In summary, they have rather not followed the example of other countries. And that came to the first key points paper, which was presented in October 2022. So you see the Federal Minister of Health who presented this paper. It was not extremely elaborated, but it was supposed to set out what the framework is going to be. And the ambitions were still the same as in the coalition agreement. So basically, really, shops where you can buy legally, pharmacies also included, and all the like. So full legal supply chain was still the plan. The problem is that already at that time it had been discussed in the legal field that it's almost impossible for Germany to go this road, even if the political will is there. Because Germany is not on its own. Germany is part of an international community, and you have restrictions of public international law, and you have restrictions of European law. So the two main instruments are the 1961 Single Convention on Narcotic Drugs, which almost all of the countries of the world are parties to, and which restricts the use of cannabis except for medicinal and scientific purposes. And the project was clearly not scientific and not medicinal. And the second one is European Union law. So you have the Schengen Implementation Act, which basically goes in the same direction and says, okay, for medicinal and scientific purposes, yes, but for all other purposes, the countries must prohibit the use of cannabis, or the possession or the trade of cannabis, like all activities related to cannabis. So that was a big problem, how to draft this bill without being an infringement of public and European law. And in reality, it wasn't possible. That's why we stand where we stand today. Now you may say, okay, there is Canada, there is Uruguay, they have legalized cannabis. How is it possible? For one, they are not part of the European Union, so that part of the problem doesn't apply to them. Luxembourg wanted to be the first European country fully legalizing cannabis a few years ago. It didn't happen for the exact same reasons that, well, we don't know exactly the process because it was behind closed doors, but they apparently got in contact with the European Commission, and it was clearly signalized to them that their plans were considered to be in breach of European Union law, and therefore they stepped back, and now they have a kind of a legalization light with a few flowers that you can grow at home, but not this legal supply chain that they actually wanted to implement. So Luxembourg had the same issues 2 years ago that we are facing now. And the other thing is that on the level of public international law, there is often a problem of implementation. So if Uruguay just says, okay, I know there's the Single Convention on Narcotic Drugs, but I'm still going to legalize, there's not so much the international community can do about it. They did do something about it, so they did send inspections and, condemned the action, condemned the legalization and all that. But in the end, if Uruguay legalizes, it will still be legal in Uruguay. That's not in line with the German approach to public international law. So Germany has always been very positive about harmonizing and about the rule of law on an international level, and that's why it's very difficult to think about Germany just ignoring a public international law treaty, which also didn't happen. But as I said, the implementation on an international level is much more difficult. On a European level, it's much easier, because if you breach a European law, no matter whether it's a treaty or a secondary law, you can have infringement proceedings before the European Court of Justice. That can be brought by the European Commission. It can also be brought by another member state, and that has severe consequences. Like you may have heard in other areas of law where the rule of law is not respected in some cases in Hungary or in Poland, then that comes with the cutting of funds, for instance, and with other disadvantages on the level of the European corporations. That's not something that you would want. And this is why when the government presented its key points paper, they said, next step, we're going to send it to Brussels on an informal basis, just for information and for their feedback. And that's what happened. That's not, as I said, it's not a formal procedure or so, where you would have a decision that has an argumentation afterwards. So it's just, they just wanted to hear their opinion. And for us, we had no doubt what the opinion of the European Commission was going to be. And that is apparently what happened. We don't have anything published on that. We only know that the minister had very good conversations with the EU Commission. But it resulted in April 2023 in an adjusted new key points paper, which is completely different from what we had seen in October, and on a very low level compared to the initial plans. So there's no talking anymore of a complete legal supply chain. It's not going to happen anytime soon. What the key points paper was actually very, very brief, only 3 pages of roughly outlining what it may be. Now we know a little bit more, because 2 weeks ago or 3 weeks ago maybe, the draft law was leaked on LTO, on a platform, and I'm going to say a few words about that. So first of all, we're not calling it a bill, because it's not the bill that is going to be submitted to Parliament for their vote, and then that's going to be it. Right now, it's only a draft from the Ministry of Health, and it's definitely going to be subject to change. So it is right now in discussion between the different ministries involved. Almost all of the ministries have something to say about this topic, because it's a very broad topic. So you have matters of transportation, you have matters of agriculture, you have matters of finance, you have matters of health, obviously, and many other things. So that's why I'm saying it's a draft law. We have to read it carefully, in the sense of not taking it too literally. It's going to change, but we will see what the outcome is going to be. What it says is there are supposed to be 2 pillars of the cannabis legislation, of the Cannabis Act that's coming. The first pillar is what's going to be what is in the first draft law, actually. That is the legalization of individual self-cultivation. So it means everybody can grow 3 plants at home, and they can consume it at home. They can invite other people to consume it together with them, but still at home. So really, that's everything that is in this closed space. And it means 3 plants per year, 3 female plants per year. So it doesn't mean at any point in time that the police would come and check. You can have 3 plants. If they come half a year later and you have 3 other plants, it's already a problem. You will see that this is one example of many that are thought from a very bureaucratic point of view. It will be difficult to verify all these things in practice, but I will give you a few other examples in a minute. But we will have this legal, safe cultivation at home. The second part of the first pillar is the so-called community self-cultivation. So that means that there will be cannabis associations, you can call them cannabis clubs, but they will be regulated by the German laws on associations, so it will be very, very well framed. They will be registered with the respective court at the place where they operate, and they can grow cannabis together, they can have a maximum of 500 members, and they can distribute these cannabis flowers to their members. They can also distribute seeds and cuttings for the first part, for the individual self-growing. But the main aspect of it is that they would grow the cannabis together and they would distribute the flowers to the members. They can't distribute it for free. That is already clear. So on the terms of costs, it's going to be a very interesting question, like what that actually will mean for an individual member, because as an association, that's why I mentioned that, a German association, they have to be financed by their own activities, and that means in particular by member fees, and then they can not distribute the cannabis flowers for free, so they will have to charge something per gram, or so they can find different models in that. But it means the whole operations have to be funded by the members. And that can be quite a challenging task because the law, or the draft law, has so many requirements with regard to the safety. It has all to be behind closed doors. If it's something that you can see from the outside, then you have to hide it. You can't show to anybody that this is a place where cannabis is grown. And you have a lot of bureaucracy to do, of course. So you may want to, if it's really a large association with 500 people, you may want to employ somebody to really deal with all the documentation that you have to do, because they have to be able to show at any point in time how much they are growing, how much they currently have, how much they have distributed, to which members they have distributed, how much, what they have destroyed because it didn't match the respective criteria. And also there is a limit to the distribution to members, so that means 50 grams per month, but not more than 25 grams in a day. So in a maximum, that means you can come twice a month and collect 25 grams. But if the member is less than 21 years old, so between 18 and 21, they can only receive 25 grams per month, and it can only be flowers with less than 10% THC. So now you start understanding why I say it's quite a bureaucratic approach. And all this has to be documented, of course. And also these clubs have to have somebody in charge of youth protection and of, so to say, a contact person for addictions that could then know about programs that there are and could refer people to other institutions that can actually provide them with the help that they would need, and that can counsel people. They should have material on this available. So it's really quite some work to do. And that's why I'm saying I'm interested in seeing how this financing through the funds only of the members is going to be put into practice. And of course, they need a license to do this. And that will be done by the regional authorities or the state authorities, depending on how the state is organized. And they will be monitored. So in some states, probably the authorities will have a closer look, and in some states, maybe not so much. But it is on the states, and that's why I'm saying this. Why? Because when it's on the states, that means that the states have to be involved in the legislative process as well. And we have many states that are not governed by the parties that form the federal government at the moment. So, in my opinion, there's no realistic way where this law will pass only through the Bundestag, through the, if you compare it to other countries, first chamber of the parliament, so to say, with the majority of the government, but you will need also the approval of the states, and that is going to be difficult. But the government for now seems to think that they can shape it in a way that no participation of the Bundesrat chamber will be required, and that would make the process much easier. But still to be seen what the final draft will look like and what obligations it will impose on the states. Okay, so that's the first pillar. That is what we have in the Cannabis Act that has been leaked so far. Many more details, like also an example which I really like is that you have to be more than 250 meters away. Like you can't, in the cannabis clubs, I forgot to mention that, you can't consume. And they can't hand out anything else that could be alcohol or sweets or whatever. Edibles are also forbidden anyway. But really, in the cannabis clubs, you can also receive you can only receive the flowers unpackaged or in a neutral packaging, and you can take it home. You cannot consume there. You can also not consume in front of the door. You must be more than 250 meters away from the cannabis club when smoking it. Now I'm asking myself, if you have to be 250 meters away and the clubs have to hide their facilities, how do I know? But that's maybe up to be seen. You also have to be 250 meters away from schools or from other places where children and young people usually can be met. So that's a very broad term, and that's one of our critiques of the law, that you have many aspects where you don't really know how that is going to be put into practice, because it means you have to know the city, basically. You have to know where the kids are. Very difficult. And also in pedestrian areas, you cannot smoke between 7 in the morning and 8 in the evening. So just make sure you bring everything and you're ready at 7:59, and then in the next minute you can start. So really, it's definitely not simplifying compared to what we currently have. That's what I'm saying. The second pillar is still under discussion. We don't have a draft law for that at the moment. It's basically that there will be model projects, so some kind of studies, but is described very roughly only in the key points paper. We are expecting, or it has been announced, that a draft will be presented in the second half of this year. But well, it's to be seen. It will take 5 years. Only adults can participate, and there will be some kind of model regions. So there can be a specific city, or it can be a county, and they will participate. And only people above the age of 18, of course, living in that particular city or county can participate and can then receive cannabis from shops under a monitored environment. I'm heading towards the end of my time frame, so I think I mentioned most of this already. Maybe, yeah, just to sum it up, conclusion and outlook. I think the cannabis clubs, some of them are already forming, so they are preparing for this. As soon as it gets legal, they want to start. It will be seen how it's really accepted, whether it really can meet the expectations, because if we go back to only half a year ago, when we had the time of the first key points paper, the key argument was that this is a major achievement for public health and that the black market is going to be completely eradicated. That was the goal that was communicated. And when we look at what has been presented now, I think we can have doubts that this is actually going to be achieved. So with regard to the protection of minors, home grow will be possible. It only says, you have to take appropriate measures to make sure that minors can't access. But how is that going to be verified? What does that mean? Is that going to mean in practice? It's very unclear. And in particular, the complete eradication of the black market, honestly, I don't think it's going to come with this. It's also not going to come with the studies, like with the pilot projects that are going to come in the second pillar. But that is the way that the German government has found to probably do something that goes in the direction they want and goes in the direction of full legalization. Because once the pilot studies are completed, that means after 5 years, they expect to then be able to say, okay, look, in the regions where we have tried, public health has actually improved because people don't get, people get higher quality of products, and it's all monitored, it's all under state surveillance. We can when we see that somebody is getting addicted and losing control, we can access them, because every time you purchase something from such a licensed participating shop, there's an offer of counseling. That is the expectation, that after 5 years you can seek some improvements, and then that is supposed to support the reasoning that the full legalization for all of Germany is actually a project of public health. To be seen. All right, thank you.